Okay, this section will be covering fitting asymmetrical hearing losses. So how do we define an asymmetrical hearing loss? Well, while there is no standard, we can arbitrarily make a definition here that should work for us clinically for most cases. We can either define it as asymmetrical hearing thresholds that could be, for example, about 30 dB or more, an average, say a 4-frequency or 3-frequency average, comparing 5, 1, and 2 versus, or 5, 1, 2, and 4 for left ear versus right ear. So we could define it by pure tone threshold differences. We could also define it by word recognition differences, so in particular PB max differences of greater than 20%. So we've already talked about the issues with binaural or bilateral hearing aid fits, more generally speaking, and that the majority of symmetrical hearing loss hearing aid users will get an advantage with a bilateral fit. And that for a smaller percentage of them, there may be binaural interference preventing them from taking full advantage of a bilateral fit or binaural fit. But when we have asymmetrical hearing thresholds, there's a new concern. When we talked about asymmetrical cochlear distortion before, there's the concern that maybe the amplifying the poor ear might add some distortion or interference in the auditory system more centrally as well, so having a negative impact on speech perception in the better ear. So for these asymmetrical hearing loss hearing aid candidates, what do we do here? Do we fit them with one aid or both two aids? If we fit them with one aid, which ear do we pick? The better ear, the worse ear, the right ear, the left ear? How do cross and FM systems come into play with this? We do know that as the asymmetries between the two ears in terms of pure tone thresholds, as they become larger and larger, that binaural redundancy advantage becomes less and less. Fortunately, that binaural squelch is usually a larger effect than binaural redundancy, and that binaural squelch advantage remains true for hearing asymmetries as large as 50 dB. So they can still take advantage of that kind of that subtraction that goes along in the more centrally to get rid of the noise from the poorer ear from the combined signal. And of course, head diffraction effects, because these are not, it's not a physiological phenomenon, it's just purely an acoustic or a physical phenomenon. Head diffraction effects will remain constant regardless of hearing loss. If we look at previous survey data to see how many persons with asymmetrical hearing loss are aided binaurally or bilaterally rather versus unilaterally, we can look back at survey data from Chung and Stevens. It's kind of old, but it's out there and we have that information available. So over 150 hearing aid users, not a huge difference between the percentage of those that were bilateral versus unilateral hearing aid users. Or rather, not a huge difference, between those with asymmetrical loss and symmetrical loss in terms of percentages of bilateral hearing aid users. 88% of those with asymmetrical loss were bilateral hearing aid users versus 70% of those with symmetrical loss. So we can see there's a trend for those who have asymmetrical hearing loss to be more likely aided bilaterally. It's worth noting, though, how Chung and Stevens defined symmetrical versus non-symmetrical or asymmetrical. With symmetrical on the left panel, number 1, you can see that either the audiometric configuration was the exact same, even if sensitivity was different. On the right side, where they're defining non-symmetrical or asymmetrical, you can see that the audiometric configuration, the shape of the audiogram, was different. However, sensitivity may be different or the same. So it really was not what we usually consider the conventional definition of an asymmetrical hearing loss, but it was really looking at asymmetries in audiometric configuration. Similar to those with symmetrical hearing losses, we can say that the majority of users who have an asymmetrical loss should be aided bilaterally, at least initially, to test its success in that condition. Here's an example of an audiogram where there's going to be considerable benefit by aiding this person bilaterally, even though we have an asymmetric loss. We can see in the left ear the patient has more loss for the highs than the lows, and in the right ear the patient has more loss for the lows than the highs. Since we know that as hearing loss increases, our ability to extract information at that frequency decreases. So as hearing loss gets worse, when sound is made audible at that frequency, the percentage of useful information we can extract will be less. However, what we also know is the brain can take information from low frequencies on one ear and high frequencies on the other ear and fuse them together more centrally to create one percept. If you recall, the binaural fusion test is some kind of CAPD test where I believe you're using high-pass filtered words are sent to one ear and low-pass filtered words to the other ear, and you present them to the patient and they get one single fused percept. So we can think of this as the crossover effect, where the high-frequency signals cross over and low-frequency signals cross over to this central image or central percept. So in this case, it's really that low-frequency amplification from the left ear and the high-frequency amplification from the right ear that are going to be the most important aspects of this. So we can say that if both ears are aidable, although there's an asymmetry, if they're both aidable, we're best off fitting them bilaterally to try to achieve that binaural benefit. It'll typically happen more often than not. What we can say, though, is the greater the loss in the better ear, the more often we're going to see that binaural benefit experience compared to just aiding the poorer ear. So since I'm saying we're comparing this to the condition where we're aiding the poorer ear, is that what I'm suggesting with a unilateral fit? So the question would be, if we do have an asymmetry and we are only going to aid one ear for whatever reason, which ear do we choose? Which ear? The better ear, the poorer ear? So here's an example of two audiograms. They have the identical audiometric configurations. They're only shifted in sensitivity. So we can see the audiogram on the right is shifted downward in sensitivity by, I believe, about 40 dB or so, roughly 40 dB or so. Same configuration, same asymmetry between the two ears. So here are some tenets we can use to decide which ear to aid for better ear versus poorer ear. We know that if we aid the better ear, we're going to maximize that dynamic range, or the range for which sounds are audible in the better ear. So really maximizing that dynamic range. On the second tenet is going to be aiding the poorer ear is going to maximize the range of sounds that will be audible for both ears. So again, the first one, aiding the better ear, maximizes the audible range for the better ear. Aiding the poorer ear maximizes the range of sounds that will be audible to both ears. So you can see that aiding the poorer ear might have a greater impact on binaural processing, or at least for localization. The better ear, when aided, is able to send a better signal. They're going to extract more information from the signal being sent to the brain because the pure tone thresholds to begin with were lower, so more useful information can be extracted. So to remind you what I'm talking about as far as the percentage of useful information that can be extracted, if you recall this figure here, Dylan and his colleagues at NAL came up with this when they were modifying the speech intelligibility index. They found that this is kind of the general trend that they found from their research, that as hearing threshold gets greater on the x-axis, you can see the percentage or the proportion of information that you can extract from amplification at that frequency where that threshold is where the corresponding threshold is going to get worse. So for this first audiogram that we looked at earlier, the milder loss of the two audiograms we looked at earlier, we can see this particular situation that when we aid the poorer ear, we're going to maximize the audible range, maximize the range of sounds that will be audible to both ears simultaneously. And so that's going to be the best tenet to follow under this circumstance. If we look at the other audiogram here, that's just shifted downward on the audiogram, in terms of sensitivity, we can see this one, we want to aid the better ear, because that poorer ear, the quality of the information sent to the brain when aiding that poorer ear is probably not going to be all that great. We may not derive nearly as much benefit from aiding the poorer ear as compared to the better ear. So these three tenets to follow, it's hard to know when to pick one versus the other. So let's go ahead and look at some group data to see what the research studies have borne out. So Swan et al. Back in the late 80s found that after a 20-week trial of unilateral hearing aid fitting with 76 adults with asymmetrical loss, going back and forth between better ear versus poorer ear, they found that only about 52% of their 76 adults were able to really say that one condition was better than the other. So just a little over half were able to say, I like the better ear, or I like the poor ear, or aiding the poor ear better, in terms of their ability to hear better overall. So the first thing to realize from this study is a lot of people really couldn't tell a difference. So that portion tells us that a lot of people were fitting unilaterally. Maybe it wouldn't matter which ear we put it on. But let's ask those people who could tell a difference, those people who clearly could tell a difference as far as which condition they were hearing better on. The startling finding here is that 80% of those who actually preferred one condition, so better ear versus poor ear, one condition over the other, they chose the poor ear. So it seems to be, if we're picking an ear, in general, maybe the poor ear would be the safer bet. But since that previous study by Swan was limited to hearing thresholds, I believe for frequency average that did not exceed 75 dBHL, we need to be careful about generalizing that to our client population overall. So a good rule of thumb would be fit the ear with a 4-frequency pure tone average, so 5, 1, 2, 4, closer to 60 dBHL. And that will help you remain consistent with those 3 tenets or factors outlined earlier. So while this is probably a good heuristic to go off of, there's not a lot of evidence to support this notion, so we don't know that it's the best rule. It's just good enough for now. So ideally these people will be fit bilaterally, but if they have to be fit unilaterally, pick the ear that has the 4-frequency average closer to 60 dBHL. Of course, a very practical alternative to this would be to have the client go back and forth between the better ear and the worse ear, and just try it out for a few weeks in one condition and a few weeks in the other, because there is still a possibility. Recall that 20% of those who felt like there was a better condition did prefer the better ear. So you could have them try both, and they can decide as well. And lastly, I also mentioned some FM units and cross units. So when do you consider FM units or cross units? Well, cross will probably mainly be considered when we feel like the worse ear, the poor ear, is not typically aidable. So when this isn't basically on an individual judgment, when word recognition or PB max is low enough in that ear where you don't think they're going to get a binaural advantage. There's no exact cutoff to give you right now, to my knowledge. Of course, FM systems could help any person with sensorineural hearing loss, and so in this situation, I would say if they have very poor word recognition or PB max in the worse ear, then you might also want to consider FM systems, or truthfully more practical considerations would be these remote microphones available through either radio frequency or Bluetooth that are available from a variety of manufacturers nowadays. So say, for example, Starkey SurfLink Mobile, or the new made-for-iPhone products with the Starkey Halo and the Resound Lynx products. Those would be good options in terms of having a remote mic and getting that SNR advantage without having to spend the money for FM or having to have the extra bulk and cosmetic detraction from FM units. Okay, the next topic we'll cover is deciding on bilateral versus unilateral fittings.